people were hesitant to come to the vaccination center, including our own doctors.
We are training the people, we are empowering the people, capacity building is being taken place.
We have treated about 12,000 plus COVID patients, yes, 12,000 plus.
Namaskar and welcome to India Science. We are at this very prestigious Bengaluru Medical College and Research Institute, one of the premier institutes of India, and we bring to you the vaccine immunization rollout drive here in Karnataka. So how's it going, Akshay?
It's brilliant, the weather's brilliant, the numbers are really promising. Let's dive straight into the drive and let's take you inside.
Let's begin.
A very good afternoon to all our viewers. We now have with us Dr. T.S. Ranganath. Thanks a lot for giving us your precious time, sir. As we were talking during the lunch time, you were telling me stories about how you've dealt with vaccine hesitancy and how you've seen it. Could you please tell our viewers?
Definitely. So this vaccine is a vaccine campaign started since January 2021. Since day one we have started in our own center, Victoria Hospital. It was not easy at beginning. So the people were hesitant to come to the vaccination center, including our own doctors, our own healthcare workers. There are very lot of hesitancies. As the times passes, slowly things are getting improved, and as we are increasing our IEC activities, we are just telling this. We leaders, we started first taking this vaccine, and we shown to that our own colleagues that I have taken and I am safe. So this slowly the message has gone. So all the healthcare workers started taking this. Still, public common man was not aware of this, not about to accept that this vaccine is safe and 100% confident that this vaccine will give protection. And because a lot of media misinformations that create, because sometimes somewhere some celebrities, some comedy persons, they have passed away after this vaccination and all, that created a lot of mess in the people. So they were hesitant to come to the vaccination center. Somehow the things are improved, and here and there the COVID app, everybody has to register in the COVID app. That also bit problem beginning, because it's a Bangalore is a metro city, people will come to the city in search of food and shelter. Many people, they will not have the identity of those. We need some Aadhaar or some authentication. That will not be there, because people are come from migrate to this Bangalore for various reasons. They may not having those things, and people who are going for abroad and all, there was a big problem. They wanted to have the vaccine, but we are not able to because of this technical issue, because of this not having the required documentation. So that's why then the local bodies like our Bangalore BBMP, the corporations, have come forward and they relaxed with the help of government. They appointed some nodal officers, and we are increasing the IEC activities. So in that way, somehow we are able to vaccinate this. But still, some people like Bangalore, I know this is what 1.3 crore population. So a lot of eateries and all those things, and people working in such industries and these things. Person who are coming to the vaccination means, of course, vaccines are available to some extent limited, and people has to bit queue in for some time, and thinking that if I go there, I may lose half-day job, half-day my wage, everything. That is an issue, because this COVID has causes a lot of social and economical problems. So these poorer bracket people, they were not able to come forward. So then we planned that let us go move towards to the wherever there is a needy beneficiaries. For example, in construction sites, there will be hundreds of people, women and child and adolescent, they are working, but the person who are taking care of those people, he will not allow the person to come to this vaccination. So where though has to go? Neither they will not have a Aadhaar card, nor they don't know language problem, where to go, who vaccinate, nobody cares. So in such time, we went to those construction sites, we did vaccination.
That's great.
Yeah, they call it as a lateral movement, and the workplace vaccination. Of course, ITBT people and all, so they know, they have a knowledge, and by Google it or where the vaccine is available in Bangalore, tick, yeah, they could come. Those poor people, where everybody cannot have the Android phone or iPhone, they has to. So we went to this field and we tackled those things. This is one part of sector, but still still some people are still reluctant to take this. I may not, something like this. So then government has made some more initiatives like if you are a poorer sector, if you are taking a ration from the government shop at a subsidized rate, here onwards you should take the vaccine, otherwise we may stop. So then if you are working in a some like factory or hotel or something like this, so they said all workers or active workers has to, otherwise we have a right to close. So when sometimes they use their force, so then they realize that without this vaccination we will not have. So then people are started coming. Now everybody in Bangalore, either rich or poor or middle class, student 18 plus, everybody has, now they are aware they should, otherwise the Disaster Management Act and Indian law will not permit. So everybody is happily coming forward and we are doing this. As of now, in my center we have a big team, it's not one man show. So we have vaccinated almost nearly 67,000 vaccination. Of course, while doing the vaccination, maybe a small portion of people might have a small 1 or 2 expected AEFI, because any vaccine is a antigen foreign. When they are injected, maybe because of this, the white coat collar, something called, when the person comes to the clinic, if you measure the BP, it will shoot up because the doctor's phobia.
Absolutely.
Something like this. Looking at the small needle, though it's very small needle, though there will be apprehensive. Before touching the thing, people will be like this. And we used to tell them, don't worry, this is a small vaccine, 0.5, nothing will happen, it will protect you. So after telling all those things, people are now accepting, and we made them to wait for half an hour, and even to some extent we have gone down. So those who are scary, we are offered a cup of coffee or tea. Then otherwise, see, we have to relieve the anxiety. Otherwise something goes wrong, if one bad incident will take up the whole day event. So every day 1,005 persons will visit to my vaccination center. We have to make sure that none of them should suffer, because one bad incident will, word of mouth, it becomes 100 times. So then very difficult to damage control. So we have taken utmost care, the trained personnel, extra persons will be there. Of course, we have conducted a vaccine on the roadside also, that even then we have taken utmost care, and now we can reach this 68,000 vaccinations doing this.
That is really great and really candidly spoken, doctor. Just one thing that I also want to ask. So the government has had to, the authorities have had to use some force, some measures of force. But do you also feel some more awareness campaigns or several programs could have been started, or are they still needed? Can they still be started by the government, initiated?
Definitely. All this time now, till now I said a common man can come and take the vaccine, because in every house there will be a lady, there will be pregnant mother, lactating, postnatal mother, something like this. So these are also high risk mothers, they has to take the vaccine. But the common notion among the public is, after taking a vaccine, they may see, they maybe 1% or 0.1% people, they may have a fever, a light pain or something, but this has made a lot of impact, and people hesitate to take the vaccine. A pregnant mother, because 2 lives, so they has to take a vaccine. So in such case, in our Indian setup, I don't think that lady is free enough to take her own decision, because doing the baby in her tummy. So she has to be again need a consent from his husband, in-laws, all those things. It is not easy to us, because India we are in a social lot of things. So in such case, whatever the legal measures will not play a major much role. So we need some more celebrities, some more initiatives has to be happen. Every time
this is a social issue.
Yeah. So we cannot, every time we cannot enforce the law itself. It's because there will be some issues beyond law. We have to. In such case, either by educating or different means has to be done. So that's why the vaccination in my hospital, we are covering both that sector also, women and child vaccination, that also we are carrying out. But that is not up to that mark. We are not happy with this, but still that has to be improved.
That is very promising actually, if there is that much improvement, considering that there has been major speculation about the onset of a third wave. Is that possible? Is it coming? Is the speculation all right? Also, we've seen that countries like Israel and USA, they're already talking about booster doses. So how do you see these next 2-3 months vis-a-vis COVID vaccination and the pandemic?
Definitely, because looking at this, our neighbor countries, neighbor states, the current COVID scenario and all, definitely everybody needs a vaccine. Otherwise, see, we have seen this in Bangalore alone. After this vaccination comes and has taken a boost, last 4-5 months, almost a major share of this Bangalore, almost I can say 80-90% coverage. So the cases has dropped. The number of patients admission to this hospital, so that has dropped. So I can proudly say, because of this Government of India, the COVAX and Covishield, the 2 vaccines we are giving this. So because of this, either any of this vaccine, those who have taken the vaccine, preferably both the doses. If not, so at least 1 dose definitely is offered. So that's why we tell a lot of those things while talking to the public and all. See, because of this vaccination, my hospital admission has come down. That is what the Government of India ambition, to cut down this mortality as well as morbidity. It has come down. So the first round is we have to cover up as much as possible all the eligible. Then definitely we do agree the vaccine, the current so many studies shows that this vaccine is developed. Maybe the antibodies after taking this, I have taken this vaccine almost in the month of January and February, 6 months ho gaya. So by 6 months definitely the antibodies will wean off this. We have to look into this aspect. Otherwise again the entire may be about risk. So we have to go for this booster dose. But when you are not covered all the beneficiaries with a single dose, just for the easy accessible people, if you are giving the booster dose, it may not be justice, I believe.
Thanks a lot for all your time, doctor. Thanks a lot for speaking so honestly, so candidly, and with so much care about people. The doctor has had both vaccine shots. I have been fortunate enough to have both my vaccine shots as well. And we urge every one of our viewers, we urge all of our viewers to take the vaccine as soon as they possibly can, because vaccines do save lives. And with that, thanks a lot for joining us. Namaskar.
Delighted to have with me now Dr. Malesh K, who's HOD Pediatrics at the BMCRI Research Center and Hospital. Thank you so much, Doctor, for joining us today. My first question to you is about COVID and children management. What is new in the neonatal wing?
BMCRI is a state-of-art hospitals and the institute in the government of Karnataka, leading in the management of COVID-19 situation in the entire state, and in that it has managed more than 10,000 cases, both adult and pediatric cases. We are adding and admitting even a severe case of pediatric COVID. We have treated more than 450 pediatric cases with the least mortality as of now, and we are admitting very moderate to severe cases. In relation to the neonatal COVID, we have seen some cases, majority were asymptomatic RT-PCR positive cases we come across. Few are having a serious outlook.
What are the infrastructure facilities that you have sort of amplified or broadened with regard to the third wave or the imminent third wave?
Yeah, so with all the administrative and the government support, we have got a contingency plan. We have got a 100-bedded pediatric ward along with the existing neonatal 182 beds. Total 182 beds are then pediatrics. And in addition to this, we are increasing the ICU facilities of 28 NICU beds and 22 PICU beds. It is a state-of-art critical care unit coming exclusively when the necessity is required. Still, there are situations and the concern with respect to disability in children, and this hospital having a more than 1,500 deliveries in a month, and the quite number of preterm babies along with the complications, the complicated delivery coming to NICU, they need to be followed up, and they are being registered and followed up in a disability the clinic, and we have got a trained personnel with respect to the psychology, developmental assessment, auditory evaluation and visual assessment, and subsequently supportive care whatever is needed, including all the government facilities needed for them. They are going to guide. And COVID care, we are training the people, we are empowering the people. Capacity building is being taken place. Few days back we have trained more than 380 the patients, and the Department of Pediatrics BMCRI is being considered as a nodal center for the training, especially in the recent circular by the government of Karnataka, DD, Deputy Director, the Health Department. And we are empowering all the people with respect to COVID management, and management is being more simplified. In addition to COVID-19, we are stressing upon the nutrition, immunization and overall aspects of child development, not necessarily COVID alone. And long-term development with respect to the COVID-19 should have the long-term impact on the overall management of the pediatric critical care in the entire state.
Thank you so much for speaking to us, and good luck.
Thank you.
to you.
Very nice
Thank
to interact with you, madam. Thank you.
Very happy to have with us Dr. Geeta Sivamurthy. So firstly, ma'am, if you could spare some time and tell us about this wonderful ward where we are sitting right now. It is really state of the art and something really new.
Thank you, madam. Thank you. I welcome for our institution, Primed University, that is a Vanivilas hospital. It is a 536 bedded hospital, and it was built by Maharaja of Mysore in 1936. And from that time we are catering the services for the woman and child. And this ward came into picture only about 6-7 months back. We thought that some emergency, this is a triage. The meaning of the triage is any emergencies has to be tackled inside the hospital, because when we see the patient there only the emergency should be taken. With that intention we thought here we have a emergency OT we are having, and scanning we are having, ECG we are having, so that we can save much time on the patient and also the improve the quality of life.
Right. So what does this entail, this bed behind me?
These beds are specially designed if the patient comes in labor, because this is a tertiary care center. Most of the patients, they come in and around by 120 to 150 kilometers around Bangalore. So they would have exhausted all the way to reach here. Some of them they come with the ambulance, some of them with their own transport facilities. So we want to do as early as the patient get inside the hospital, we want to render the services. This year, if I tell you the statistics from January till now, we have done about 8,895 deliveries.
In COVID time?
Yes, this is January I am telling.
Yes.
This is in the January non-COVID cases, and during the first wave and the second wave we have done about 329 COVID mothers we have delivered.
Dr. Geeta, I want to ask you one very important question now about lactating mothers. Supposing the mother is COVID positive and the child is not, because it does not transmit by the placenta, then can she breastfeed? This is a question that is very important to India.
Madam, earlier first wave when it came early about 1 or 2 months, there was a dilemma whether we had to breastfeed the baby or not, and most of us we were not still in the trial time. So our ICMR guidelines and the pediatric society also, they told mother should not feed the babies and it has to be isolated from the mother, and if she want to breastfeed also express milk has to be given. That was the thing it was told to us. After that, as the days passed and so many research we started doing, and we got a new guideline that baby can be with the mother about 6 feet away from the mother, and somebody has to take care of the baby, and whenever the baby is hungry the mother can be breastfeed it, wearing the face mask, hand wash, and also the mask she can use and the face shield she can use, and all hygienic procedure she can take and she can breastfeed the baby.
Very important conversation that. And I want to ask you another question now as to, you've created something called the Human Bank, Milk Bank. Please tell us about that.
Human milk bank is in our Karnataka, in the government setup, this is the first one. Though it is happening in Rajasthan and Chennai, different places it is happening. We thought this is essential because of the so many preterm babies, and also now the COVID mothers are more, and some of the patients, they are, if we are telling them to positively breastfeed also, they are not willing to breastfeed the babies because it may be transmitted to the babies. So we thought CLMC, that is a mother's milk bank, is very essential, and our government has supported us very much to establish this. And the other thing is, we got donors also to get some equipment for us, and which is we have started mom's milk, and also the this milk bank also has started, and it is functioning. We are very happy.
Tell us about the vaccination numbers during COVID time, because that is important for lactating mothers and pregnant mothers.
Pregnant mothers, initially they were reluctant to take the vaccination, and general public also. But after our counseling and also so many counselors guidelines as per the government, and we have very proudly we can tell we have vaccinated more than 500 mothers, and also the lactating mothers also we have vaccinated more than 100.
ನಿಮ್ಗೆ ಯಾವ್ದಾದ್ರು ಮೆಡಿಸಿನ್ಸ್ಗೆ ಅಲರ್ಜಿಕ್ ಇದ್ದೀರಾ? ಇಲ್ಲ. ಏನಾದರೂ ಮೆಡಿಸಿನ್ಸ್ ತಗೋತಾ ಇದ್ದೀರಾ?
ಐರನ್, ಕ್ಯಾಲ್ಶಿಯಂ,
ಎಕೋಸ್ಪ್ರಿನ್. ನೈಟ್ ಎಕೋಸ್ಪ್ರಿನ್ ತೊಗೊಂಡಿದ್ದೀರಾ ನಿನ್ನೆ?
ಹಾಂ.
ಓಕೆ. ಇವಾಗ ಎಷ್ಟು ಮಂತ್ ಪ್ರೆಗ್ನೆನ್ಸಿ?
7th month.
ಇದಕ್ಕೂ ಮುಂಚೆ ನೀವು ಯಾವಾಗಲಾದ್ರೂ ಕೋವಿಡ್ ಪಾಸಿಟಿವ್ ಆಗಿದ್ರಾ?
ಹಾಂ, ಏಪ್ರಿಲಲ್ಲಿ.
ನೆಗೆಟಿವ್ ಆಗಿ 3 months ಆಗಿದೆಯಾ?
ಆಗಿದೆ.
ಓಕೆ. ನಾವಿವಾಗ ನಿಮಗೆ ಕೋವ್ಯಾಕ್ಸಿನ್ ಅಂತ ವ್ಯಾಕ್ಸಿನ್ ಕೊಡ್ತಾ ಇರೋದು, ಇದೇ ವ್ಯಾಕ್ಸಿನ್ನು 0.5 ml IM ಕೊಡ್ತಾ ಇದ್ದೀವಿ. ಇದಾದಮೇಲೆ ನೆಕ್ಸ್ಟ್ 1 month ಆದಮೇಲೆ ನೀವು ಸೆಕೆಂಡ್ ಡೋಸ್ನ ರಿಸೀವ್ ಮಾಡ್ಕೋಬೇಕು. ಈ ಇಂಜೆಕ್ಷನ್ಸ್ ಕೊಟ್ಟ ಮೇಲೆ 99% ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ. ನಿಮಗೆ ಮೈಲ್ಡಾಗಿ ಮೈಕೈ ನೋವು, ಫೀವರಿಶ್ ಅನ್ನಿಸ್ಬೋದು. ಅನಿಸಿದ್ರೆ ಒಂದು ಪ್ಯಾರಾಸಿಟಮಲ್ ಟ್ಯಾಬ್ಲೆಟ್ ತೊಗೋಬೋದು. ಬೇಡಿ, ಹಾಫ್ ಆನ್ ಅವರ್ ಅಬ್ಸರ್ವೇಷನಲ್ಲಿರಿ.
How nice. And on that note, many thanks for joining us today. More power to you, more power to your center. Namaste. Joining me now is the Dean and Director of the Bengaluru Medical College and Research Institute, Dr. Jayanti. Such a pleasure to speak to you, ma'am.
Thank you so much for this opportunity, Nidhi. Actually, Bangalore Medical College, it started as a private medical college in 1955 and was then later on handed over to the government of Karnataka, that is the then government of Mysore, in 1957. But then the hospitals, I think they go a little way back from 1900. Right. Victoria Hospital was established in 1900 on December 8th by Lord Curzon. Then our Minto Regional Institute of Ophthalmology, that started in 1896, and Vani Vilas Hospital in actually 1935. Of course, the other two additions, that is the trauma and emergency block in around 2015, and the PMSSY, that is the Pradhan Mantri Super Speciality Hospital in 2011 and 12. So BMCRI has got 5 attached hospitals. So that's it. That's about the brief history of Bangalore Medical College over a span of 43 acres.
It's such a beautiful place. Unbelievable education and research work going on here. Can you please highlight the new developments or infrastructure facilities that have been added during the pandemic time?
Actually, our journey, our COVID journey, I would say it started on March 26, 2020. So the first patient to Bangalore Medical College Victoria Hospital was a French national, and the first day, the moment he entered, he asked for broad beans. He wanted beans to be given to him, and that was not in our menu, so we had to scramble and somehow we had to get him that beans, So that's how it started, and probably I think on that day we really didn't know, because it was sort of an uncharted territory. Nobody knew anything. About uncharted waters, about the virus. Everybody, we were all on a learning curve. So all of us came together, and we have, in fact, including our PG, senior residents, and all the head of the departments. So we all sat together, we came out with some treatment guidelines, COVID protocols to be followed, everything. So I think we were the first one in Karnataka at least. I cannot talk about other states, wherein we said the asymptomatic and the symptomatic, they have to be separated, you know. So we had a green zone, an yellow zone, an orange zone, and a red zone. So depending on the oxygen requirement of these patients.
This is in March 2020.
Yes,
Oh, lovely.
yes. So we did that, you know.
But your hospital is also stated to be one of the best in India, especially about Victoria Hospital. That is what is the reputation. Tell me about the other new things, ma'am.
So incidentally, subsequently we had an inspection by the central team, and they said, yes, this is a beautiful treatment guideline. The protocol that is followed should be emulated all over the country. They said Victoria Hospital could be a role model for the entire country. So I think that credit should go to all my teammates, you know. So all of us have really worked very hard, tirelessly and selflessly during the first pandemic. We learned so many things, and I'm very proud to tell that we have 400 plus COVID studies, probably the highest in India, I'm not too sure, but then 400 plus COVID studies we have done. Point number 2 is, yes, I think the government has gone out on a limb to support our hospital, because it was a COVID dedicated hospital, and we had to start with, we had only about 50 beds, 50 ICU beds. Later on we added another 30 beds, 30 ICU within 15 days. That was actually the handiwork of the government, you know, the finance was arranged and everything was in place within 15 days. So the second respiratory ICU came up within 15 days. So we are very proud of that.
Oxygen, is there anything you'd like to flag?
Oxygen, fortunately for me, yes, you know, the second pandemic, yes, there was a real stress. I will say that we were going neck to neck, you know, so we would look at the oxygen truck and feel very happy. Okay, yes, because now the oxygen has come, there's no problem. And in fact, I should thank the company also, Praxair, who supplied oxygen without any problem to me. So that way we never had any issues with oxygen supply. Of course, we had oxygen concentrators also. So that also additionally we used, and somehow we could tide over the crisis of oxygen.
You've also started tele-ICU. Tell us about that, and how are you monitoring these COVID patients, and what was the turnout at the peak of the second wave? And what are you doing to prevent the third wave or raise the facilities?
To answer your first question, yeah, tele-ICU rounds, probably I think the concept came up because of my PGs, I would say, and my senior residents. So they said we wanted to avoid unnecessary exposure of COVID to our doctors, healthcare workers. So we have a beautiful control room wherein we can monitor the patients from the control room itself. Okay, we can talk to the patients, and the ministers, they used to come there, talk to the patients about the facilities and the care given to them, and everybody is very happy because we can minimize exposure to the healthcare workers, yeah, by this control room rounds. Yeah, that's one thing. And we also had a Dozy app installed, you know, which can monitor all the vitals of the patients continuously. So these two important things, I think, really helped us to tide over the waves and also prevent unnecessary exposure. Then one more very important thing in a government setup, I would say, is we establishing the COVID Rehabilitation Center, okay, wherein we have state-of-the-art equipment to assess the lung functions and other functions in post-COVID patients, because these patients can come with various problems, you know, after 1 month after discharge. So therein we have a state-of-the-art equipment. They can come here, they can enroll and get tested and also get treated.
What about the peak of the second wave? What were the numbers that you saw?
So till date we have treated about 12,000 plus COVID patients, yes, 12,000 plus. So, and almost I think 300 mothers have delivered healthy babies. That's a very important thing. Yeah, and we had about I think 456 children, and only 6 deaths so far. So that way what I've seen, you know, like I think the statistics of Bangalore Medical College, as far as the children and adolescents are concerned, I think it matches that of AIMS, because AIMS also about 402 patients were studied. So we have studied about 456 children, and most of them had mild infection or asymptomatic, and only about 6 deaths we have seen so far.
Absolutely. On that note, I'd like to thank you for joining us today.
Yes. Thank you so much
Best
for this
of luck
opportunity,
for
Nidhi. Thank you very much.
And with this, we come to an end of this vaccine rollout immunization drive from Karnataka and from Bengaluru Medical College and Research Institute. Keep watching India Science.